Hello, my name is Mattias Lundin. I am from the company Lumito, and I'm really pleased to be invited and glad to present our fine company for you. This is me, Mattias Lundin. I started with Lumito 3 days ago. Before that, so bear with me, I can say. But still, I have a background from a company called CellaVision, which is having digitization within hematology. And before that, I've been working with the Getinge Group for quite some time in different roles. Why did I choose to join Lumito? I was quite excited by the technology, with a novel and new technology within a market that has a big potential, and the digital pathology part is definitely growing and will continue to grow. And of course, it's interesting to make a difference with this medical device. So what is Lumito? Lumito has a device which is a scanner with bright field and with laser. And in combination with reagents, it's possible to illuminate cancer cells in a new and special way. We have patented the combination of these things, hardware, different light sources, and the reagents around it. And for sure, it's a large potential within pathology, which will become digital pathology over time. And what we are currently doing is fine-tuning the technology and doing validations in laboratories. This is the agenda for today. A little bit about the demand in the market, and of course the technology and the product. I would like to describe that for you. And then the vision, the strategy for us, and the goals and milestones that we have defined. A little bit about the expertise and collaborations we currently have. The patent portfolio I just mentioned, just show you that. And the possibilities after the first version of the Lumito solution. A little bit about the board, management, shareholder list, and then the conclusions at the end. So the market, the way we see it, is that it's pushing to save cost, searching for efficiency, turnaround times needs to be faster and faster. The accuracy and being consequent in the way you are seeing your diagnosis, and of course the patient safety is key here. Connectivity, as we all are in the world of many things are going digital, so the same thing within tissue diagnostics and pathology. So what we see is a lack of resources, too few pathologists. Pathologists are being retired, and not enough experienced are filling their shoes. And of course, more and more increasing tissue samples driven by the aging population. And of course, this is creating long analysis times and waiting for an answer on a potential cancer situation is not good. Need for greater coherence, and of course more reliable results from the diagnosis. Today 80% of the time pathologists are spending on healthy tissue rather than potential cancerogenous tissues. And of course this is causing a lack of efficiency and high costs for the healthcare systems across the globe. And the consistency when it comes to breast cancer biopsies is only 75%, only. So meaning that there is a potential faulty for 25%. The potential of the pathology is 6.5, or the projection I would say. So it's $6.5 billion US, the big potential of pathology, projected in 2027. Today it is a little bit over $4 billion US, and the annual growth is 6%. The digital pathology growth is way larger than this. So the portion of increasing for making it digital is way stronger growth than this. 30% is within Europe, 40% in US, 20 Asia, and then the rest in the rest of the world. A little bit emphasizing what I just said. So starting at the 4.12, going forward towards the 6.5. So it ends up with a accumulated growth on close to 6%. To your right, in the picture, you see the segmentation, the way it looks today. The far majority is within hospitals, and then you also have commercial pathology labs that are working on tissues. And then the 14% is the pharma companies, and then a small percentage contract manufacturers are using this. A little bit about our technology in Lumito is about nanoparticles that we are adding to a reagent, and then in combination with the laser is doing the trick and getting the area that you would like to look at much brighter with high contrast. So this is how it works. The primary antibody recognizing the target on the tissue. So what you see here is typically a glass slide. So you're taking a piece of tissue from any part of the body really, and then putting it on a glass slide, staining it, and then detecting it with an antibody. And then the secondary, so this is the nanoparticles that are then being attached on the first staining that you are applying on the glass slide. And then you are adding the laser beam, and that makes the engine, so the nanoparticles are glowing and showing very clear. And then we are taking pictures of that and getting it digital so you can see that on the screen. So this is how it typically looks with a standard H&E staining. And here the pathologists, the oncologists are trying to figure out what is cancer and what is not. And this is here when they are spending around 80% of their time looking in microscopes, manual microscopes, for potential cancer areas. To the far left is the standard, again, the standard labeling when it comes to stains. In the middle, you see the comparison where Lumito has, with their technology, has added the nanoparticles. So you see the areas, the cancer areas that are interesting to look at, and is then helping the pathologist to quickly detect where it is and what it is and so on. And then to the far right, you see a more combination between the normal staining that is used across the globe, and the new method that we are introducing now from Lumito in the middle. So you see to the right, the areas of interest is then the yellow part, and the rest is then the healthy tissue. So the benefits in a summary is a higher contrast, and of course higher quality imaging. And you're getting it digital. You don't have it in your microscopes on a glass slide that you're putting on the shelf somewhere, and you would like to go back later and look at what happened with this patient. Then you have to get the glass slide. Here you are having it saved digitally, and it will remain the way you made your pictures from the very beginning. And of course, opportunities to connect with expertise in other parts of your country or your world. So that's really, and this is increasing, making sure that the diagnosis is more accurate than in the more old standard version that is commonly used today. And then over to the area of strategy. So we believe this is a game changer product for diagnostic support. So the long-term vision is then to release resources from the pathologists that are now reviewing pathology glass slides, so making it more efficient and making it more accurate and correct in order to put treatment in as quickly as possible, and then having it saved also for the future and having it digitally accessible. Showing the previous slides with the Lumito slides that it's very clear the cancer areas. This will most likely be very beneficial to add artificial intelligence or machine learning to this, to have some more decision support and making some of the job the pathologists are doing today more automatically, to helping out classifying things. That's kind of in the next phase, in the next step that we are foreseeing. And of course, the idea that there are players in the field, big players that are working and supporting the pathology field today. And we believe there's a good opportunity to have a plug-in version within other current players, their solutions, with adding Lumito's technology into those solutions. That's also an idea that we have, and we are seeing the likelihood of that as well. Short about the marketing strategy, we are in a phase of validation of our first version of Lumito solution. Reference customers will get hands-on experience using it in the clinical labs. The steps that we have now. And then of course working with partners when it comes to sales models to reach customers, first in Europe and then of course across the globe, and then manufacturing of scanner and also production of reagents as well. The aim is to have the CE marking this year, 2021. We are starting with Europe and making sure that we are having focus on one market, and then Europe is also a big market, so of course we will also select the runner-up countries, but for sure the Europe and CE marking is the aim for the near future. Some milestones, patents across the globe. We've been working with a quality consultant company in order to help us with the ISO 13485. The first scanner came to us in Sweden in June 2020, and then some more patents was granted in Europe also during last year. We have established our own laboratory in Lund in Sweden, where we do have our office. Probably didn't mention that in the beginning. The expected milestones in front of us is of course the ISO certificate for our quality system, the CE mark for the product, and of course a lot of discussions with partners in order to prepare ourselves for the commercial rollout. We also have a milestone and a plan for changing the listing from NGM, which we have today, to Nasdaq First North also this year. The good news, it's not only Lumito, myself, and the fantastic colleagues that I'm working with, but there's quite a lot of pathologists around us in Sweden, but also elsewhere, that have been getting knowledge about our technology and are also, I mean, we are seeking advice from them, but we also have quite a few reaching out to us and are excited. And here is one of them that we are closely working with in order to fine-tune and really getting a solution that is good and attractive for the end customer, the pathology labs. Some of the partnerships that we are working on, the technology partnership in Cambridge with the scanner part, RISE in Gothenburg, lab environments and IT that we are also getting help from. The patent portfolio is here. It's really about, I'm not going to go through the details and the numbers and the dates here, but if you can see there are quite some dates, 2030, 2038 and so on. It's really about the combination between the different parts that is creating the unique Lumito portfolio. And then looking beyond where we are now and the years, the couple of years to come, of course, we believe that after Europe, we need to be in other markets of the world, both mature markets, but also more immature markets where the potential is right. And of course, Europe, North America, and then the rest of the world. We need to make making the system more automated in order to gain even more efficiency over time. And of course, maybe 10 years and forward, there are also adjacent areas where we believe the technology can be applied upon. But we are now focusing on cancer. But there are the opportunities also potentially in other areas. Coming a little bit about our board. Let's see if I can. So we're having our board with a diverse expertise and knowledge and experience, with a chairman, Masoud Kayami, doctor in chemistry and quite an entrepreneur. We're having some really commercial people in the board with Ulf Widén and Ulf Bladin, and a professor in surgery, Roland Andersson, and then one of the persons behind the invention around the technology, Stefan Andersson Engels, is also part of our board. And then over to the management and the employees, all the ones that are working with the solution. So this is the picture of all the employees that we currently have, and with a lot of activities driving this company forward in order to come to market as quickly as we can to help customers across the globe. Shareholders, like I said, we are on the NGM currently, and the largest owner we have is the chairman of the board, Masoud Kayami, but we also have some more institutional companies. Avanza is a pension fund in Sweden, and Nordnet is another pension fund in Sweden that have quite some shares also in the company. Let's see if I can change. Oh, there you go. So now we're coming to the summary phase. So why invest in Lumito? Yeah, I will try to explain that if it hasn't been clear so far. So it is a mature market as such. The pathology market is a nice big market which is mature in a way. But what's happening in the market is a transition from traditional microscope to making it digital. And that market is not mature, so that's a market that is actually accelerating and is a new market where some players are in, but with our technology we are having our own position in this field, and there we are alone as for now. And I mean, the growth of pathology as such is 6%, which is decent, but the digital part is growing faster, and we would like to be part of that and get a fair chunk of that business. There is a need. I mean, it all starts with customers, right? So there is a need for better diagnosis of tissues, and here we are coming with a solution to that need, to that challenge. We are unique in having a patented solution for that need. And as we speak, we are having ongoing discussions with partners that could help us reach the customers that needs our solution, and also helping us with making sure that we are having products, everything available for the rollout and supplying the demand that we are expecting. I think this is, then we're having the launched final bullet point there, already mentioned. And then this is my final slide, 38 slides. Did I manage my time or?
Just perfect.
Just perfect, okay, wonderful, thank you. So I think thank you for listening, yeah, sorry for looking at this direction because that's been the screen. You don't see that, but that's been my help in order to keep myself to the script. Thank you very much, and now we're going over for questions, I think.
Mattias, first congratulations on starting in Lumito.
Thank you.
You come from Celavision, which has been a fantastic story both as a company and the product it delivers and the stock market. I can see many similarities between the companies. What are you seeing? Can you compare, contrast where you see the business models between the two? You're obviously much earlier stage, but how do you see this developing in contrast to, for example, how Celavision has developed?
Yeah, thank you for the question, and I definitely see similarities, and of course Celavision is within hematology, but the need for change for hematology in Celavision and the need for change and something new within Lumito, the driver is the same. So I would say you're coming from a conservative business where tradition, many years of looking in microscopes and staining in a different way, in a similar way and so on. It's the same in pathology. So there's definitely similarities. And of course, making pictures, so technology-wise, I mean, it's a different technology, but what the technology is bringing to the table is again similar. The combinations are different. The combination of the technologies are different, but if you're summarizing it a little bit roughly, I would say you are very close, right? But you're fully right. Lumito is in an earlier, I mean, where Celavision was 12 years ago. I mean, that's maybe something like that. Yeah.
One of the strategic issues that Celavision, sorry for coming back to this, but it's such a great comparison here. One of the strategic issues that I believe Celavision has and had is in the distribution of this, and you were VP Global Sales in Celavision, so you had this. They teamed up with global distributors, a handful of these,
yeah.
But it also limited their possibility to down the line go themselves to market. How do you see this play out for you guys? Where do you want to go? Do you want to go distributor model, or do you want to go own sales model?
Yeah. I really would like to come back to you on that. This is yeah. did I destroy the excitement here? No, but I started three days ago, and of course I've been doing a little bit of homework, but I just stopped with Celavision and I entered into Lumito 3 days ago. And I think I have to hold it there. Yeah. So, yeah.
Can you? That is probably also a little bit early to start to sort of. Can you lay out sort of how you think about path to profitability? I mean, you talk about potentially having an established product in 5 years' times.
Yeah.
What kind of sales level do you think it will take to get to break even? How should we see sort of money-wise in Lumito?
Yeah, and I'm sorry, I'm not able to answer you on that either. I'm really sorry. I would love to do that, but I can't. When it comes, I mean, just of course, if you're looking at the big market that I'm talking about, the pathology market, the $6.5 billion US, there are certain players there, and there are certain very big players in this chunk. And of course, one is wondering, how do we access this chunk? Is it on your own, or is it via these big players? And so I mean, this is really relevant things, and we are looking into that as we speak.
Sounds like we should expect some sort of major strategy update from you guys down the line.
Absolutely, yeah.
Lars, do you have any questions for Lumito?
Yes, sure. Well, I was just thinking about your technology, understanding your technology, right?
Yeah.
So, do you need? I suppose you need antigen-specific antibodies when you are diagnosing different cancer types, right?
Yeah.
And so it's not a unique technology in terms of it's not that general. You could say you have to adapt it to the different cancer types, right?
Yeah, not to the different cancer types. So it's possible to have the same for cancer as such in that perspective.
So that, how should I understand this? That means that your technology is able to enhance the imaging of all kinds of cancer types when you are...
I mean, for the moment we are looking in to breast cancer, and that's what we are setting up the antibodies and the nanoparticles for in the first phase.
Yes.
And then how much adaptation is needing for other types, I really have to get back to you on that, and having those details, the technical aspect of that part.
And I was thinking about we were talking about the AI, and the algorithm and so on, and I suppose that's going to be something that will play a major role in digital pathology in the future.
Yes.
But now you're moving into an area where there's a lot of competition. There are a lot of very strong players in this market, right? So you were also mentioning that you were looking for some kind of a plug-in solution.
Yeah.
And that would probably be a good solution for if you're going to collaborate with big players rather than compete with big players. But I suppose that you're a pretty small player, so
yeah.
It would be very difficult for you to sort of compete with these big guys, right?
Yeah, absolutely. I mean that might be the case, and we are evaluating the options for this. And one option is to explore the opportunity to have a plug-in version, meaning that we are then getting in a partnership with one of the or several of the bigger players. So that's one option that we are exploring at the moment.
But are you currently working on AI and algorithm and so on, or that's something that you are looking into now?
Yeah. No, the AI. I mean, the AI part is an area that we will explore, but we are not currently working on that. Yeah.
Thank you.
Yeah, thank you.
Sting, do you have a question
Yes.
for Lumito?
Several questions.
Great.
Several questions.
Start now.
Wonderful.
First of all, I just want to make sure I understand your product correctly. You have a scanner, and your value proposition to the pathologists are that they still have to look at the same amount of samples, but they can do it faster.
Yeah.
As in the first generation product.
Right. I mean, yes and no. So it's a possibility to make a duplexing. So looking at it in two different ways. That will also be in the first phase. So you will gain efficiency there also. But the first is a single. So you have to look at the very same amount of samples. But we believe it will be much faster because it will be easier to detect. So that's kind of the idea. And then the duplex part is then an area where we are also looking into making an efficiency gain in that aspect as well.
Do you have any estimates on how much time to be saved? Or
No, I don't. I mean, we really need to have studies on these things with close cooperation with end customers using it.
Okay. And then further down the line, in terms of revenue split, sounds like you're going to sell the machine
Yeah.
and then the supplies.
Yeah.
What should we? How should we look at that revenue-wise?
Yeah, I mean, we are definitely having an aim and a focus on the recurring revenue, meaning the liquids. I cannot give you any splits at this point. I don't. But it's going to be a capital part and a recurring liquid part as well. Absolutely.
When can you tell us more about that?
Yeah, that's a good question.
You're gonna launch.
Yeah.
It said you're gonna launch later this year.
Yeah. No, absolutely. So that means that we need to cook down the business models and having that perspective. So absolutely.
And then 2 more questions.
2 more questions. Okay.
First one. I know you've only been here for 3 days. But,
So I have. Yeah.
Have you taken over any commercial plans or launch plans that you're just gonna carry them out, or have you already found anything you want to change?
I'm reviewing where we are and what's the current status, and is it correct to maintain the plan, or is correct to but I'm not expecting any revolutions. But of course I will definitely look into everything and if needed, we will have some adjustments. Yeah.
Okay. And then lastly, the most annoying question.
Okay.
Last month there was quite some turmoil around the stock.
Oh, there you
because
go.
of some contradicting press releases.
Yeah.
Can you elaborate a bit on that and tell us how you make sure that it's not going to happen again, or what happened?
Yeah. I would say, I don't think the press releases were contradicting. I mean, I know it's claimed they were, but we believe they were not. So I don't think. I think it might be some misinterpretation or mis-evaluation of us being a small starting up company where we are appreciating milestones and would like to tell you about that. Yeah, where the other counterpart, which is a counterpart, we have been collaborating with Sectra for many months, so that's no doubt about that. And it's ongoing as well. So there's also no doubt. But then again, I think then the bigger company in this sense doesn't necessarily see this as that's the most strategic partnership in the world. But there is an agreement. There is a signature from both companies. We are having things to do going forward. That's how it is, and that would be my comment.
Just one?
I go back to you guys.
Just one?
Just one, Lars. Just one short.
I was thinking about, you mentioned this with, it was you need to raise the productivity in pathology, right?
Yeah.
And what I'm thinking about is that, digital pathology, that's a little bit in competition with the traditional microscope, you could say.
Yeah.
So isn't that kind of a challenge to your business model, that a lot of pathologists maybe stick to the microscope instead of looking into this new area?
Absolutely. And I think it will probably be a competition versus tradition. Would be one competition that we will have. And I've been seeing that before in previous jobs. And it will be competition, with the right competition, if you will. But really, I think the far majority are used to manual microscopes and will have preferences about the way it is perceived, the color, etc., etc. But there is ways to turn that around. We've been doing that before in previous companies, so I'm confident that is possible to do.
And now one last very short question from Morten.
Yeah, it's going to be a bit sensitive as well, but it's on your funding and some recent news flow around Guardian possibly having a bit of a funding issues themselves. How do you see Abbott, given his third day in office, it's a bit tricky, but how do you feel about your cash position versus the need for investment through 2021?
Our cash position, or whose cash position?
Your cash position. Yeah. But if you want to comment on Carmen's
No, I don't. No, I don't. So that's what
well.
I would like to reject. Because I don't. No. I believe our cash position is with our current setup. We have a sufficient cash position.
Carden is a long-term shareholder believing in the story, as I believe.
Yeah. Yeah.
Okay, Mattias, thank you very much for coming to Copenhagen.